getting diagnosed is supposed to bring relief. Instead, many people discover they're entering a completely different battle. Nobody teaches you how to prepare for appointments. Nobody explains insurance appeals. Nobody gives you questions to ask. And when you're already dealing with a serious diagnosis, the last thing you need is to become an expert in healthcare administration overnight. My guest today knows that struggle firsthand. As someone living with acromegaly, she's experienced it herself, but after seeing healthcare from the inside, she made a surprising decision. She walked away from her successful career in the pharmaceutical industry to help patients become better advocates for themselves. Neelam Vyas, welcome to the show.
Thank you so much for having me. It's a pleasure being here, and I'm such a fan of the community that you're building.
Neelam, I'm a fan of yours as well. Thank you for being here. What inspired you to quit your job in Pharma and start Advokit, the app that you have?
I decided to leave my job in Pharma after working for Eli Lilly for about 8 years. When I got that diagnosis of acromegaly, it was kind of a moment when I just felt this calling that patients needed to have more tools that were built specifically for them. And I set out on this mission to make the tool that I wish I had in my pocket from day one that I think would have helped me get to my own diagnosis faster. And that inspired me to build Advokit. With Advokit, I am building this app to empower patients with the education, the advocacy skills, and the patient-centric tools to take more ownership of their healthcare.
Before we dive deeper into Advokit, can you tell us a little bit about your journey with acromegaly and how it all started?
Absolutely. We're actually coming up on about 1 year since I was diagnosed. But when I think back about my whole lifespan, my first symptoms and the first abnormal test results started happening about 12 years before diagnosis. And it was 8 years before diagnosis when I really started to feel some big changes in my body and I started slowing down. 8 years ago is when my symptoms started to hijack my life and really drive every single decision I was making. So the very first symptoms that I started to feel were definitely the widespread pain, widespread fatigue, weakness. And over the years, it felt like more and more things just kept falling apart. So whether it was my heart health or my breathing, my digestion, and definitely my jaw, over 8, 9, 10 years looking for a diagnosis with really hard symptoms, I actually also got a $40,000 total porcelain bite reconstruction because my bite had just shifted so much that my mouth wasn't functional. So I had spent, this decade of my life searching for answers and trying to get to the root cause of why I was feeling so bad. I was a frequent flyer of the healthcare system. I added it up and I had been to over 50 doctors across 6 or more hospital systems. I've accumulated more than 37 patient portals. And finally, I got to this point last year of disability and desperation where I took medical leave from my job to go full in on finding the answer. And it ended up with me in a doctor's office begging for the brain MRI that would lead to my diagnosis.
Let's talk about your pituitary surgery. Where did you have your surgery and what year was it?
I had my surgery last year at Mayo Clinic. And they were able to get 70% of the tumor. Like a lot of patients, it had grown around the carotid artery, so they couldn't get the full thing.
Based on your background in Big Pharma, what advice would you give to people being an insider and learning kind of the tricks of the trade?
I think the very first thing that I learned is that there are so many layers and players in the system that there is a lot of friction, and it makes it really easy for your care to just kind of slow to a stop. So you have to be active and continuing to push your own care forward. The other thing I learned is that it is just how important prior auths have become to the way that healthcare is administered today. That's probably the most shocking thing to me from being in pharma was understanding the prior auth process. For those who don't know, prior authorization is something that insurance has introduced where they have to sign off before they are willing to pay for a treatment, maybe for imaging, for a procedure, especially for those that cost more. So, particularly working in pharma, if there's one piece of advice I can give, it's that if you ever hear that your insurance did not approve the prior auth, make sure that you're communicating that back to your doctor so that they know to appeal. We know that appeals can succeed about 80% of the time, but what I saw a lot behind the curtain was that sometimes that message that the prior auth was denied somehow wouldn't get to the doctor's office. You might get the letter in the mail as a patient, but that memo might miss your doctor's desk. So the biggest piece of advice is make sure you're connecting the dots if you ever get any sort of pushback from insurance.
That's some good advice. Let's talk about the biggest unspoken rule in healthcare. What would that be from your perspective?
I think the biggest number one unspoken rule is that you've got to be your own record keeper. We're in 2026 and our phones can talk to our car, our watch, our TV, our thermostat, right? And I think that we reasonably expect that our data, our healthcare data is also just as connected. But the truth is, it really is not. It is quite messy. And in fact, just to put things in perspective, we still have a lot of offices operating with fax machines as a big part of the process. So the technology, the interconnectedness, it all kind of lags behind what we experience in the rest of our lives. And it becomes incredibly important for you to play an active role in keeping your healthcare together, your healthcare data together. One thing I would say is if you have a very complex condition like we do, your best bet is to get all of your care under a single big hospital system that's multi-specialty. In those cases, a lot of your doctors are able to see your care across specialties. The issue is as soon as you go out of a big system like that, maybe your insurance changed, maybe you're going for a second opinion. Once you leave a big system like that, then that introduces the chance for your care and your health data to become fragmented. So it really is on you to help your doctors keep all the pieces together and get serious about documenting everything.
Let me ask you this. Was there a specific moment or breaking point when you said the system is broken and I need to do something about it?
Yeah, I think that moment came for me when I got my diagnosis. I was just overcome with this feeling of validation that, wow, there really was something wrong this whole time. But also just huge amount of frustration and disappointment in the system. I had been very diligent about pursuing healthcare and trying to find the right answers and trying to put in my part as a patient. But because there are all of these unspoken rules, and there is no playbook for how you're supposed to be a patient, it's really hard work. And especially you're already at a disadvantage from day one because you are not feeling your best. A lot of us are operating at like 20% of our normal capacity and you know, we're running on fumes. So you're already at a disadvantage from day one as a patient. But then add to that all these layers of complexity, the lingo, the insurance hoops, all of these processes and complex economics of it all, it's really hard for the average patient to know how to navigate all of that. And for me, now that I've spent, you know, time in pharma, I've been able to talk to hundreds of doctors and get an understanding of their pain points. And I've also been to hundreds of appointments on my own. And through that process, I've really been able to identify the patterns where the system breaks again and again for doctors and for patients.
For me and my diagnosis, I just kind of rolled with the punches. At the time, I knew nothing about acromegaly. My doctor pointed me in the direction of an endocrinologist and a neurosurgeon. I didn't go any further. I didn't dig any deeper. In fact, I really didn't even want to be a part of the process and was totally afraid and knew nothing about the healthcare system at that point.
Yeah.
Let me ask you this, Neelam. You talk a lot about empowering patients with advocacy skills. What does effective self-advocacy actually look like in a doctor's appointment?
I found in my own journey that when my care was getting stuck, there were 3 things I started doing that really made a difference in terms of moving my care forward. The first is knowing your story and your timeline. I have had the chance to survey doctors and understand from their side what makes for a successful appointment. And time and again, I heard them say that they really rely on patients, especially those new patients coming in, to be able to give a concise overview of the timeline. And that includes knowing what medications you're on, why you're on them, and what other treatments you've had. The second thing that you can do to be an advocate for yourself in your appointments is to go in with a goal and a plan. We know that these appointment windows are really short. In fact, we have some studies that show that for primary care appointments, for example, patients have only 5.3 minutes of talk time during the appointment. That is a tiny amount of time to give a lot of information you probably have been sitting on for months. So it really helps to go in with a plan of what you're going to say and what you need to ask. And I'd also recommend opening the appointment by stating your goal up front so that you and your doctor have an idea of what a successful appointment looks like, and you can make the most of that time together. Finally, the third thing I would advise on is to take backup with you. So when I got married, I finally had a husband I could bring with me to my appointments and really started to feel the difference in terms of remembering everything that I needed to say and everything that I needed to do. But there were like 10 years before that when I was doing this all on my own. And so I know it's not always possible to take a family member or a friend with you. If that's the case, then you can try asking your doctor to record the appointment. And I've been pleasantly surprised in my conversations with just how many doctors are open to this as long as you're transparent about the ask and you let them know you're recording just to help you remember the appointments, especially if you're hitting, brain fog or just have a million other things going through your mind. The cool thing is that with Advokit, I've been building in all of the tools to help you do all of this so you have a partner in that self-advocacy for your next appointment.
You mentioned Advocate. What exactly are you trying to solve with it at its core?
As I've had the chance to talk to doctors and talk to patients, one of the things that has become clear is that we share this common pain point, which is that these appointment times are so incredibly short. Sometimes they're averaging like 15 minutes of actual face-to-face time between doctor and patient. On the patient side of things, that often leaves us feeling dismissed or unseen or like we weren't able to share everything we had to say. And on the doctor side of the experience, they're experiencing a lot of burnout trying to keep up with these short appointment windows and all the paperwork that demands that come with it. So Advocat's trying to solve that by helping patients show up to the doctor more prepared. We help patients put together a visit guide so you kind of have this agenda and you can stay on track during your appointment to make sure you're addressing the most important things. We also have the Recorder in-app that generates a summary and instant to-do list. And then there's also a record-keeping feature in there as well so that you are able to provide a snapshot for your doctor. One of my favorite things about the app is that it's designed to move with you and it is not trapped behind multiple portals. So you're able to take this tool with you in your pocket to every point of care that you have and to see all of your to-dos and all of your summaries on a single dashboard.
My doctor has often mentioned to me to record keep and use such an app. So I actually think this is a great idea. Moving forward, if you had your app when you started this process, how do you think it would have worked out for you?
I think for me, one of the most emotional parts of this whole experience was feeling very alone in navigating this and trying to learn all of those rules by myself, trying to learn how to get organized by myself, and trying to learn how to find my voice in this very complex system. And I think that with a tool like Advokit, I would have been able to show up and taken advantage of my appointments to make them go further.
You mentioned that you're married and you have your husband home. Does he help out with your acromegaly and your day-to-day activities?
When I was seeking my diagnosis, absolutely. Was at a point where I was struggling to drive. I was struggling to help out around the house, to cook, anything like that. And my husband definitely rose to the occasion and helped me through and has been an incredible moral support as well through all of this. Um, the good news is that with the right medications, now that we found the root cause of all my symptoms, I am starting to get more relief, and it is becoming easier for me to take care of myself and of my own healthcare. But man, right before diagnosis, when things were at their very worst, it was so invaluable to have help.
Support is definitely the name of the game. And that's the reason why I asked if you had any, because there's so many people who don't. I'm blessed to be able to have a wife who helps me out as well. What would you say to someone newly diagnosed if they felt alone and needed some advice?
I think you're right on. I agree. Community is the best medicine. There were times in my journey when things were really dark, to be honest, and, I started to withdraw socially because I felt like nobody could understand what was going on inside, and I was very aware that I looked a lot better than I felt, and I just really struggled to connect with people, um, and was embarrassed, quite frankly, with how bad things had gotten. But I had a kind of mental shift somewhere in my journey where I set a new policy for myself and I said, "Okay, Neelam, you've gotta just show up." And what that meant to me was stop planning to feel my worst, start planning to feel my best, and make an effort to show my face. And then give myself the grace. If I wasn't feeling well enough after a minute, that was fine. I gave myself permission to leave. But more often than not, just showing up ended up putting me in the places where I was surrounded by the people who strengthened my soul, and made me smile and kind of got me out of my body and made me feel like I was living again. And, I know it's not always possible when you're dealing with an illness as complex and, debilitating as acromegaly. It's not always possible to just show up, but to the extent that you can, um, I would absolutely encourage leaning into your community. I'm super grateful because right after diagnosis, I discovered you and your channel and also the acromegaly support group on Facebook that Jill has so preciously cultivated as well. And so if you're a newly diagnosed patient, we are out here. We feel you. We've been through the whole roller coaster of emotions that you're probably going through right now and are happy to welcome you with open arms.
Moving forward, what keeps you going on the hard days when things get heavy and you don't feel as well as you wished you would?
I think it's hope. There was a point, Tony, when I was so convinced that life was just going to keep getting worse and worse and worse, and the symptoms were just going to continue stacking up. But after surgery, after getting on the right medications, I am finally having more good days than bad days. And that is incredibly precious to me. I am so, so grateful for that. And so when I do have those days where I'm still feeling all the symptoms again, I use that as motivation to remind myself, I'm doing this for all the patients out there trying to find their answers.
Neelam, we're at the point in this conversation where I want you to finish this sentence. Are you ready?
Yes.
The person I was before my acromegaly diagnosis would never have believed that one day I would
Be able to dream again. Quite literally, I'm getting way better sleep after the surgery. But also, I am just reuniting with this ability to think creatively and expansively and dream big about what I want from my career and from my life. Um, I think that when you are dealing with a chronic illness, your life shrinks very easily, right? It all kind of collapses in on itself, and you're suddenly your mindset shifts to one of scarcity, where you're just thinking of, okay, how do I survive the next minute or the next day? It's hard to really plan for tomorrow or 5 years from now or 10 years from now. So having the right medications and finally starting to feel better means that I'm able to plan and dream in a way that I hadn't been able to for a really long time. And that has just given me a new lightness and excitement for what's to come.
It's better to live life and enjoy it than be unhappy. That is some great advice. If this conversation helped you or reminds you of someone who could benefit from hearing it, please help us reach more people. You can do that by clicking that subscribe button. I genuinely appreciate the support. Also, like the video, share it with others, and leave a comment below. You can also follow me on all my social media platforms. You can find those in the description of this video. Neelam, I want to thank you for your time. I want to thank you for joining me today. Most importantly, Neelam, I want to thank you for talking acromegaly and pituitary with Tony. It's been a pleasure having you today.
Thank you so much, and wishing you and your viewers and listeners all the best.
Thanks for watching.